Mr. Speaker, Madonna Care community in Orleans has suffered unimaginable challenges and tragedies as a result of COVID-19. With over 30 cases amongst the staff, the private operator of the home has struggled to maintain adequate staffing ratios. Family members report having difficulty getting timely information about their loved ones, and the media report describing a work environment that is haggard, with dedicated staff lacking proper PPE and at least one staff member working 4 consecutive 16-hour shifts. Mr. Speaker, it's clear that the amazing medical team at Madonna are doing all they can for their patients. What is also clear is that the iron ring around Madonna has crumbled. Mr. Speaker, when will the government step in and put in place a plan to get Madonna Community Care back on track?
Minister of Long-Term Care to reply.
Thank you, Speaker, and thank you for the question and welcome. Our government has been using every tool possible, taking every measure possible. In terms of the Madonna situation, I can tell you that we've had Ontario Health involved since May the 2nd, the Royal Ottawa Hospital, the Ottawa Hospital, the Children's Hospital of Eastern Ontario are all supporting Madonna, the staff and the residents there. CHEO and the Royal Ottawa are currently staffing 100% of the home's requested needs, including environmental services supervisor and cleaners, and in total 11 personal support workers. 2 culinary staff have been deployed by CHEO and Royal. An inspection team was on the ground on Friday. I want to assure you that we are taking every measure. We are in regular contact. The drastic situation is there is a shortage of staff across our homes in Ontario, for many of them in outbreak. But we're actively working on that, making sure that they get the support they need, supporting our staff and supporting our residents, all our loved ones in long-term care.
Thank you very much. The supplementary question.
Mr. Speaker, I appreciate the Minister for her response and our communications over the last number of weeks. But Mr. Speaker, over this past weekend, I've heard from staff and family from Madonna describing an ongoing situation that does not seem to be getting better. One family member wrote in regards to PPE, and I quote, "It doesn't just work to say there is enough and it's being used. Unfortunately, there needs to be more direct involvement and supervision of the staff and PPE continually." According to reports in the Ottawa Citizen, one registered nurse was asked to leave because she raised concerns that the use of PPE was not safe and did not meet public health guidance. CUPE has filed a grievance because of the lax infection protection control and risk assessment reviews being done when staff from outside hospitals are deployed to support the nursing home. So my question, Mr. Speaker, when will the government demonstrate to the families and the community alike that the situation at Madonna Community Care is under control and there is a long-term plan to manage the COVID-19 crisis at Madonna now and over the coming months?
Minister of Long-Term Care to respond.
Thank you, Speaker, and thank you again for the question. This is an ongoing situation, not only with Madonna, but several other homes. We are aware and acknowledge the issues there in terms of staffing, and that's why we are using the hospitals, their SWAT teams or the rapid response teams, their infection prevention and control teams, their staffing, and you can see that the hospitals are rallying around the homes that need the support. And the efforts to shore up the staffing will be ongoing. We know that Madonna is getting the support that they need. We are in regular contact, and homes in these sorts of situations are required to put forth a plan in terms of what they need so we can meet their needs. That communication is ongoing between the teams that are supporting the home and the ministry, also Ontario Health, also the Ministry of Health and Public Health. All measures are being taken to support these homes. As you can understand, this is a trying time. It is a challenging time in long-term care, not only in our Ottawa homes, in Ontario and across the globe. And everything is being done to support Madonna. Thank you.